As a professor of epidemiology, I'm curious how you interpreted the different tone we heard yesterday from President Biden versus what we've heard over the last 10 months from former President Trump. We heard President Biden yesterday begin comments to the press about COVID with concerns about the families that have been affected by the virus and the 400,000 plus people who have died from the virus. At the same time, we heard him be pretty direct with the American people, saying that 100,000 more Americans could die from COVID over the next month. I do think it's fair to say this is in stark contrast to what we saw from President Trump, who used terms like turning the corner and even said that the virus would be gone by last Easter. I'm wondering, as a professor of epidemiology, what you make of those different approaches and different ways to communicate.
So I would say as a professor of epidemiology and just a public health practitioner, someone who is seeing what's going on a daily basis here, tears of relief that we are now hearing the honest to goodness truth. We are being told what the data say in clear and accurate terms. We have a massive plan. I mean, when we think about this, there are over 400,000 people who have died in almost a year. The Civil War was the largest contributor, largest single event of death in the United States history. It was over 600,000, it's estimated to be. And if you think about how we've been progressing towards that and these projections that we could potentially have another 100,000 deaths, I mean, this is something that we cannot tackle state by state, community by community. Everybody has to pitch in there. And I think the president's call for Americans to do what we do best and respond in this crisis is absolutely key. However, we need that national plan. We need data collection, data sharing, best practices, evidence-driven approaches to lead us out of this, as well as focusing on vaccine, but also therapeutic development, all these other pieces that really are going to complete the picture. So this idea of essentially having kind of a wartime effort to combat this virus, it's been so desperately needed. And I am hopeful that it will help us come out on top.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.